Hello, I'm Shannon Brinker, and I want to welcome you back to the phone call consulting and scheduling piece of our whitening specialist module. Now, before we begin, I want you to understand, as we've talked about in the other beginning first two modules of this section, is that this is where it is really important for you to have conversations with your team that work up front. And when I say that, because one of the things that we know is that everybody is really, really busy. And when someone calls, when we go to talk about having specials and running your marketing campaigns, that the person up front does understand what to say. And this can make or break your practice for the reason that they need to understand the whitening process as well. And when I told you that I introduced 3 types of whitening in my practice, this is where you really do need to train your team who is answering the phone and working up front what to say, because we don't want to contradict ourselves, but most importantly, bringing in patients that really are not good candidates from the get-go. And one of the things that I will say is in my practice, no one comes for whitening unless they come through me, which means they really should come through whoever has this role. Now, why do we want to do that? Because even in a practice like mine, where we've got 59 team members, we're all going to say something different. And so it is important that you do educate your team. Now, listen, nobody's perfect, right? And we know that there are going to be people that are going to come in where we're going to do a consult with them, and then we're going to figure out that they're not a good candidate, or most people are a good candidate. It's usually if they have restorations on their front teeth, just like Linda, where we're going to fall into an instance where we're going to have to break bad news to them unless they're ready for restorative. So here, though, what I want you to understand is where we really do need to have conversations with our team, again, up front, so they understand what to say, and most importantly, kind of preparing them for the consult and the information that we're going to give them. And again, this goes back to taking it very, very serious. So before you really start this process, you really want to have some education to the team. So let's get started. Let's talk a little bit about how that is going to work. When a patient comes in, that's one thing, to be in the hygiene chair and we can move them over to my chair and have that conversation. But a lot of our patients are going to come in because we're going to be running specials and they want to hear about it, right? So this is something that, again, we want to look at. When we think about how long does tooth whitening take, and that's something that is always going to come about. I'm calling in regards to the special that you're running. Okay, great. A couple of questions that I want to ask you before we schedule your appointment is just asking, have you ever whitened before? Okay. And just some other questions, what type of whitening are you interested in? Because it just kind of gives me an idea when I go out to get the patient, what am I looking at? And what am I, kind of gathering that information from the team in regards to that phone call. If my team gets into a situation where they don't feel comfortable or they're not really sure, they'll say, well, Mrs. Jones, one of the things that I'd like to do is have Shannon give you a call back. So this way we can gather some more information, but she can give you some other information about the whitening process. Now, let's go through time and schedule first, because the in-office whitening, if you're new at this, is going to take anywhere from an hour to an hour and a half, right? Because we don't want to rush, and sometimes 2 hours until you get your spiel down, you get your, the flow of how you're going to do it, right? Once the flow is established, your time is going to be cut more and really cut down to, anywhere from an hour to an hour and 15, 20 minutes. But out of the get-go, we want to make sure that, you're going to gather the proper records. You're going to think about the photos. You're going to be able to talk to patients about the 3 types of whitening that you're going to be doing for them. We also want to make sure, if you're doing it in office, that you know how to go into the back and take those impressions first, take them in the back, pour them up really quickly, fabricate a really good custom tray. That's what we're going to be doing. And then delivering that tray in the chair at the same appointment time, because the more that the patient comes back, the less really income you're making, because we're sucking up chair time and schedule time for another patient. So we want to maximize the procedures that are happening in the chair at that time. And the other thing right now is we're all dealing with a lot of issues with the COVID, right? So we want to maximize the number of procedures that we possibly can do in the chair. Now, For custom tray whitening, we're still going to take in photos. We're still going to have a way for us to be able to make sure that we are gathering, the right type of impression. And again, pouring it up, make sure that we're going to deliver those trays. So the custom trays, I like to have about 30 to 45 minutes, right? Because they may not be a good candidate for the custom trays, or it's where I'm going to try to talk to them about maybe doing the in-office / take home. And if I'm going to do that and have that conversation, they still will be a candidate for me for the custom tray. We just want to add the in-office to it so I can take impressions and already have those trays pretty much ready for the in-office, okay? If that makes sense. With the pre-filled, I usually can do that within 30 minutes. And this is where we're going to at least try to get that first in-office, that first tray for the pre-filled done in the chair with me, because I don't want patients to burn themselves. I want to go through the process. I want to make sure they understand how to utilize those trays. So we don't have patients that burn themselves that don't want to do it again or continue to use those pre-filled trays. Because remember, what did we say is in those pre-filled trays? Is it a carbamide or a hydrogen? And we know it's a hydrogen, right? And hydrogen is very strong and it can burn the gums. So we want to be really careful, okay? Now, notice on this day, it does not mean that I am better than anybody on my team. I am wearing a white lab coat. I am only having a conversation. Now, if you think about wearing your gown and your shield and your mask, I'm not saying you don't have to do that, but what I am saying is we're not really getting into any aerosols at this point. We're having a conversation. So I'm going to go out, greet my patient. Again, things a little bit different now, right? I used to go out and shake their hand. Now we might do an elbow, high five. But again, it all goes back to your verbiage. And what I'm going to say is, Ms. Jones, my name is Shannon, and I am the whitening specialist here at Coastal Cosmetics. It's a pleasure to meet you today. And we're going to kind of spend some time talking about the whitening process. And so I'm very excited to meet you. And I'm also going to be escorting you back to one of our suites. And we don't call our operatories, we do call them suites. Because I think it really lowers the patient's anxiety and they know that we're really going to take good care of them. And a lot of things that we do is really what we say, right? So one of the things that we talk about along the way is, photos of patients and some of the patients that we've treated and really gathering that type of information, but most importantly, making them feel comfortable, all right? The next thing is we're going to start that conversation. We're going to go through and talk to patients about, having, especially patients that I've had this where they come in and they are pregnant and thought that they could whiten their teeth. Are you pregnant? Are you breastfeeding? And one of the things that we know now, and, do we know that this is a solid, circumstance that has been proven? Well, there's some issues in the past where patients have sued the practice because they felt that the reason they had their teeth bleached was because they had an embryo and some, either lost the child from a miscarriage or had a child that maybe had some deformities and some issues. And one of the things we do know about peroxide is it does hinder embryo growth. And so has that been proven? I'm going to tell you, I don't really know, and I'm not here to cite those, but I do want you to understand that bleaching is not something that has to be done right away. So if a patient comes in and they think they might be pregnant or they are breastfeeding, I want to wait till they discontinue that, because I never want to have any thought in someone's mind that we were the contributing factor to a miscarriage. And so I do take it very, very serious, and there's nothing wrong with waiting. The other thing is that we want to make sure that the patient has had an appointment for a cleaning and everything looks good. We're not really doing whitening on someone who has a lot of decay. They have had that. And the one thing that we do know is that the best whitening treatments come when patients have had a cleaning pretty soon and not a longer period of time. When we think about, has it been within 6 months? I feel comfortable. I don't want a patient like Linda that had some calculus, which we really need to make sure it's not there. But the other thing is making sure that we've got fresh, clean enamel to whiten, right? Let's be realistic and use our brain here that we really want to make sure patients get the best result. Now, remember what I said, anywhere we place the whitening agent is going to go into it, but I want a clean, healthy mouth to work with, okay? The other thing is I want to know, are their teeth sensitive? Because if their teeth are sensitive just to having a cleaning, I need to know that, because am I arbitrarily going to place a 45 or 40% hydrogen peroxide on their teeth and know that they've got sensitivity? Because the last thing I want is for them to be in pain, and guess who's going to get the blame? Me or you. And so I need to know that. And if they have bleached before, I want to know, did they continue to do it? And most importantly, did they have any issues with it? Because if patients say, oh my gosh, I only did it for a short period of time because my teeth were so sensitive, or I had to skip a day because my teeth were so sensitive, I want to know that, okay? That's really, really important to document. And we're going to talk about that here in just a little bit. The other thing is I always ask them, have you whitened before? Because why do I want to know that? I want to know, are they compliant with what they did before? Because if they did not follow through with the whitening that they paid for prior to ever seeing us, what's the difference today? What's going to be the difference? So I want to stress that. And you say, Shannon, oh my gosh, I could never say those things to a patient. Sure you can, because of the fact that I am considerate of the money that they're paying. I always want to know, have they ever whitened before? So I know what they utilize. Most of my patients have said I've utilized Crest white strips. And I say, oh my gosh, that's a really good way of whitening your teeth. How long did you do it? Did you do it every day? And did you utilize all the strips? Let me tell you, 99 will say, well, I did it for a few days and I stopped. Well, why did you stop? Well, I got, busy and I didn't have time, but I also thought, well, they look good to me and they're starting to get whiter, so why would I continue? But most of the time it's because they are, seeing good results and they just kind of get bored with it, right? And if they're been in a practice that has in-office, I'm asking about that. Well, did you have custom trays? No, we just did it one time. Well, what kind of results? Well, we saw a little bit of whitening, but it wasn't really what I thought it was going to be. Or, yeah, I've done it, and actually they made me some trays, and I'll say, well, do you still have those trays? Yeah, well, how do they fit? They actually fit pretty good. I just thought maybe I would come in for a consult and see. Now, listen, I am not about gouging someone. If they have trays, I want to see them, and that's one of the things that my team will ask up front is, do you right now have whitening trays? Because if they have whitening trays and they fit, I don't understand why we would want to remake them just so we can make some money. No, it's so ethical. Remember, at the end of the day, my ultimate goal is to get them into restorative if there's areas that they need to have restored, because of the fact that, I think that's very ethical, but people now really trust me. They know that I am there to be, kind of a middleman to my doctor, but most importantly, I'm representing the practice on an ethical basis, because they already don't trust us sometimes. People say, oh, I hate the dentist. I want them to understand that I am here to be their best friend. I'm here to help them. And so that's really important. And if they've ever whitened before, I want to know what it is and I want to know what kind of results. And if they can't remember the name, I know enough about bleaching systems that what the syringe looks like, I pretty much know what that color means, right? Blue is usually Venus and white is usually with a green, or that peach color is going to be opalescent. So it's not rocket science once you start to learn your materials and your manufacturers, okay? And then if they didn't wear them, this is where it's so important, is to say, now, Jane, the last thing that I want is for you to make an investment for whitening and you don't wear the trays. So if you're not going to wear them, we got to find another avenue for you to whiten, because the last thing that I want is for you to pay me the money today or pay our practice today and you don't do it. And that's where we don't get the results that we're hoping to get, because with this process, you need to do it every single day. Don't skip a day. And if you come back and see me and you tell me that you did it and I can look at your teeth, I'll be able to tell where you did it or not. And if you don't come back and see me, I'll know you didn't do it because you didn't reschedule, because you didn't want me to get on you, right? And I kind of smile and I laugh and kind of look at them, but I'm really serious, just so you know. And I'll say, listen, I take it very serious that you have to get a really good result, or I wouldn't be known for what I'm known for in this area. And what I want you to understand is that patients come to my practice for me. They don't even know my dentist because I get referrals from other patients. So I do take it serious. And this is something that you're going to see and you're going to build. And dentists, if you are really listening to me today, your team will gather this. Let me tell you, my doctor loves it. I get patients into my practice that never were patients before because of other patients. So this is where we take it very serious. And if you've had them in the past or you're in Invisalign, why would I make you new trays when you're wearing the Invisalign trays for 22 hours a day, 7 days a week? That makes no sense. So those are really good trays. Regardless of your feeling on whether they're too tight on the teeth, believe it or not, they're really good trays. So please consider that. And trust me, I'm not blowing smoke. I've been doing this for a long, long time. And I have 3,000 whitening cases, and they weren't photoshopped. They were shot in RAW. So you're here for a reason. You got this module for a reason, and I want to see you be successful. These are the things you have to ask. And then the last piece of this is, do you smoke? Now listen, I had a doctor that is a friend of mine, and he was really honest. He said, Shannon, I don't like to whiten people that smoke because I know that they're not going to really listen to me about it, and I just feel like it's not worth it. And I said, that's crazy, because the patients who smoke, first of all, you might be able to get them to stop smoking, and second of all, they're the ones that are going to continuously order and buy and purchase the bleach. So it's really important, that you do that. And the other thing is we might be able to convince them, because of the change that they have, to stop smoking. That's my ultimate goal. And I will tell you that I can't tell you how many patients have stopped smoking because of this process. You're saving someone's life or adding another 7 to 10 years to their lifespan. So think about that. And for those patients that have this self-inflicting stain that we've already gone over, and we're going to go over again, drinking coffee and tea, again, do I want to just do a one and done with it in office, or do I want to give them a pre-filled system? I really want to continue that income coming in the practice, and that's where the mentality is going to come in. I want that income coming into the practice, where if they drink coffee and tea, I will tell them, listen, now it's really, really important for you to understand the regimen, because these teeth will start to relapse a little bit, and this is where we got to stay on top of it. So we continuously have the great change that we got for you. We want to continue that and keep it that color for the rest of your life if we possibly can, right? So this is where the initial trays are going to come in with the whitening in the box, but then we're going to continue to have those syringes purchased by the patient, okay? So that's what I want you to understand. These questions are really, really important. Now I'm going to sit and talk to the patient about the whitening that we offer. Why is that important? They need to understand what it is that you offer in your practice, which is why the handout that goes along with this module is so important. The first type of whitening that we do, Jane, is this one. I want you to understand that the very easiest thing that we can do is whitening procedures that are in a pre-filled whitening tray. Now, I do want you to understand that Crest White Strips is very, very good, okay? And I'm not here today to talk bad about it, but this whitening seems to be a great way for me to give you a higher end percentage of whitening, because we know over the counter they don't have that right, and we're in a dental office, so we can. But the other thing that I want you to understand is this is filled with so much whitening or so much bleach in it, and this is a tray that's going to go all the way back to the first molar, and you can wear it for anywhere from 30 minutes to an hour, and we've got lots of different percentages. And I will tell you that it is a hydrogen. It is probably one of the strongest ways that we can whiten your teeth for a short period of time. And so here is the whitening that we charge $50. So I want you to know that. And we see great results, but the great results come from the shade of your teeth, and that is the determining factor. So A's and B's, we find really get great results. C's and D's make it really tough, and we got to have time. Whitening comes from time, which is why we offer different types of procedures. Now, let's go into the second way that we can whiten your teeth, and this is from a custom tray. We take impressions of your teeth and we customize a tray that fits only your mouth. And so here, we'll take impressions, we'll pour it up, we'll make a really nice fitting tray. And what happens is this only fits you. Now, you can't share it with your husband, you can't share it with your sister. And yes, I've had people ask me, believe it or not, I know you're thinking, ugh. But believe it or not, we do have patients that ask us that. And we have different percentages based, again, on the color of your teeth and the wear time that we need, okay? The last one, which is my favorite way because I see amazing results, is from this one, okay? So this is our in-office whitening. And what we do is we place a barrier on your gums to protect them because, yes, this whitening can burn you. And we do this with 2 applications. Remember, I am changing it just a little bit. So, hopefully people from Ultra don't get mad at me, but I do change it. And I like to do 30 minutes, 2 30-minute sessions. And what we do is we'll protect the gums, we'll place it on the teeth, and we'll do 2 30-minute sessions. And while we're doing that, I like to make a custom tray for you. So before we start, we take an impression because I definitely want you to be able to maintain it because we do see a good result. We see about a shade to a shade and a half. Don't lie to the patient and tell them they're going to get 5 to 7 shades because when you suction that bleach off, they're not blind. They're going to see, well, it's not that white, okay? So this is a jump start. That's why it's named Boost. We're going to get you started, and then that night you're going to start doing the trays. So this way we can get you moving. And what we see with this in-office first is that we see about a shade to a shade and a half, which is the equivalent to about 3 days of home tray whitening, okay? But what we see is this is a jump start to get you ready, get everything started, where it would take you several days to be able to achieve what we're going to get in the chair. And then again, we're going to follow up with a custom tray. Now, if a patient says to you, well, what's the difference in the shade? Am I going to see a better result in the shade in the end compared to the custom tray? Well, listen, Jane, I want you to know that I will not lie to you. I'm very, very honest when it comes to it because I take it really serious or you wouldn't be here in my chair. So at the end of the day, if you do both the way I tell you to, you will get the same result. If I put them up side by side, you'll get the same result. What this does is it allows you to get the result quicker, okay? Because what I worry about is for someone that's very busy like yourself, because I always ask them, what do they do for a living? Why do I want to know that? Because if I get a lawyer, they're busy. And I'm going to tell you, they're the ones that are probably not going to finish because they are busy. And I'll say, listen, based upon the job that you have that's hectic, time consuming, the most important thing for me is to get a good result. And so I would rather do this than to not have something that you're going to continuously utilize. So let's be honest with ourselves and most importantly, be honest with them. Because at the end of the day, it's not just the practice name that's on the door that belongs to my doctor. They're here and for me to take it really serious, which is why, again, I am successful with it. So I want you to be the same. And again, I think that that's where, training you to be very realistic, but most importantly, telling the truth and knowing what to expect. It's not that I'm saying you're going to lie to them. I know that. I know you're not. But when I look someone dead in the face and in the eyes about the things that I know and see, not only do they trust me, but they also trust me when it comes to those other procedures and other things that I see with their teeth. So this is so, so important for you to understand. Now, when I tell them this, the other thing of this is everything that we do today and the decision that we make for the type of whitening that's the best for you depends on the shade of teeth that you have. So what I want to do now is I want to take some photos of your teeth so we can look together to really make a decision on what is the best type of whitening for you that not only is going to work, but most importantly, give you the best results. All right, so let's talk about that photography and get into this next section here of this learning module, Becoming the Whitening Specialist.